Why should we use the Mako robot for the partial knee or the total hip? A great question that patients always ask. The goal of any joint placement is to have the most accurate placement of the components and have the most optimal outcome. Using the robotic arm to assist with the surgery, we can put the components within a sub-millimeter level of accuracy that was not available to us before we had the use of the robotic arm technology. It will not allow the surgeon to err outside of the area that you set for putting the components in. So the recovery time for either a partial robotic knee replacement or an anterior robotic hip replacement is really this. We get you walking the day of surgery. In fact, I usually like you to walk twice the day of surgery. And then from there on, use a walker for a day or two, usually to a cane for a few days. Most people by 2 weeks are off of the cane, and most people by 6 weeks are returned to fairly normal function. For partial knee replacement, I expect therapy for about 6 weeks. For the robotic anterior hip replacement, we don't do any physical therapy.
This technology allows us to be able to produce outcomes that are, in my opinion, exceptional. Radiographically, when we see these images in our office and we take x-rays, we see that these implants have been precisely placed to the end of the femur and the top of the tibia, and we know that if these implants are appropriately aligned, the likelihood of success and that these patients do well long term is very high. So the benefit of the Makoplasty and the robotic arm is being able to reproduce the positioning of these implants essentially almost in an exact fashion, so that we can feel comfortable that this patient has the best chance of having longevity with the implant that's been applied.